Gestational diabetes. What pregnant women need to know. Did you know that gestational diabetes affects approximately 10% of pregnant women worldwide? This condition occurs when the hormones produced during pregnancy affect the way your body uses insulin, which can result in high blood sugar levels. But what does this mean for you and your baby? Well, if left untreated, gestational diabetes can lead to complications such as preeclampsia, preterm labor, and even stillbirth. Additionally, it increases the risk of type 2 diabetes for both you and your baby later in life. So, it's important to talk to your healthcare provider about your risk for gestational diabetes and get screened if necessary. Causes and risk factors. Did you know that some women are more likely to develop gestational diabetes than others? Certain risk factors can increase your chances of developing this condition, including being overweight or obese, having a family history of diabetes, or being over the age of 25. But what's really interesting is how hormones produced during pregnancy can affect the body's ability to process insulin. During pregnancy, your body produces more hormones, which can make it harder for insulin to do its job of regulating blood sugar levels. This can lead to gestational diabetes, even in women who have never had diabetes before. And speaking of family history, did you know that genetics can also play a role in the development of gestational diabetes? If your mother, father, or siblings have diabetes, you may be more likely to develop it too. Symptoms and diagnosis. Did you know that many women with gestational diabetes don't experience any symptoms at all? This can make it difficult to detect the condition without proper screening. However, some women may experience symptoms such as increased thirst, frequent urination, and fatigue. It's important to note that these symptoms can also be normal during pregnancy, which is why it's crucial to get screened for gestational diabetes. So, how is gestational diabetes diagnosed? Your healthcare provider will likely perform a glucose tolerance test. During an oral glucose tolerance test, OGTT, for gestational diabetes, the pregnant woman is asked to fast for at least 8 hours before the test. The test usually begins in the morning, and the pregnant woman is given a sugary drink containing 75 grams of glucose. After drinking the solution, blood samples are taken at specific intervals, usually 1 hour, 2 hours, and 3 hours after drinking the glucose solution. The blood samples are then analyzed to determine the woman's blood glucose levels. In general, the following are the normal blood glucose values for each time interval during the OGTT. Fasting, before drinking the glucose solution, less than 92 mg per deciliter. 1 hour after drinking the glucose solution, less than 180 mg per deciliter. 2 hours after drinking the glucose solution, less than 153 mg per deciliter. 3 hours after drinking the glucose solution, less than 140 mg per deciliter. If the pregnant woman's blood glucose levels are higher than these values, it may indicate gestational diabetes. Further testing and management will be necessary to ensure a healthy pregnancy for both the mother and the baby. Early detection and treatment are crucial in preventing complications for both you and your baby. If left untreated, gestational diabetes can increase the risk of complications such as preeclampsia, preterm labor, and stillbirth. Treatment and management. Did you know that gestational diabetes can be managed through a combination of lifestyle changes and medication? Dietary changes, such as reducing your intake of carbohydrates and sugary foods, can help regulate blood sugar levels. Exercise, such as walking or prenatal yoga, can also help improve insulin sensitivity and reduce the risk of complications. In some cases, medication such as insulin may be necessary to manage gestational diabetes. Your healthcare provider will work with you to determine the best treatment plan for your individual needs. It's also important to monitor your blood sugar levels regularly, either through daily finger prick tests or by wearing a continuous glucose monitoring device. This can help ensure that your blood sugar levels remain within a safe range and reduce the risk of complications. Managing gestational diabetes during labor and delivery is also important. Your healthcare provider may monitor your blood sugar levels during labor and adjust your treatment plan accordingly. In some cases, induced labor or a cesarean section may be recommended to reduce the risk of complications for you and your baby. Complications. Untreated gestational diabetes can lead to a range of serious complications that can put both the mother and the baby at risk. One potential complication is preeclampsia, a condition characterized by high blood pressure and damage to organs such as the liver and kidneys. Gestational diabetes can also increase the risk of preterm labor, which can lead to a range of health issues for the baby. Another serious complication of gestational diabetes is stillbirth, which occurs when the baby dies before or during delivery. This is a rare but very serious complication, and it highlights the importance of early detection and management of gestational diabetes. Furthermore, gestational diabetes can increase the risk of developing type 2 diabetes in both the mother and the baby later in life. Women who have had gestational diabetes have a higher risk of developing type 2 diabetes within 10 years of giving birth, and their children are also at increased risk of developing the condition. By managing gestational diabetes through dietary changes, exercise, and medication if necessary, women can help reduce the risk of complications and ensure a healthy pregnancy for both themselves and their babies. Conclusion. In conclusion, gestational diabetes can be a serious condition that requires careful management during pregnancy. By understanding the causes, symptoms, and potential complications of this condition, pregnant women can work with their healthcare provider to ensure early detection and proper treatment. Remember, taking steps to manage gestational diabetes can help ensure a healthy pregnancy for both you and your baby. So don't hesitate to talk to your healthcare provider about your risk for gestational diabetes and get screened if necessary.